We are here live at IMCAS in the Nuvia digital world, and I am here joined by the top aesthetic medicine professionals in the world. And next to me is one of them, Dr. Jochen Badouin, a fellow German. Hello.
Hello, Flo. Nice to meet you here, and thanks for the invitation.
Well, it's my pleasure. Let me ask you this first. What is your first impression about IMCAS? What are the trends that you're seeing?
Okay, here at IMCAS, really, it's my first time at IMCAS, to be honest, but it's overwhelming. So many people, so many colleagues here, a lot of new technologies, new products, and I learn a lot here, really.
Well, IMCAS is definitely about learning, and now we want to learn from you a little bit. I know that you use the Nuvia products and fillers in your daily practice. What would you say are the benefits of the PEGylierter fillers?
Yes, on a daily basis, I really see a lot of advantages, to be honest. As many of my colleagues, or most of my colleagues, I injected BDDE fillers for a long time, for years. And since 1.5 years, I'm familiar with the Nuvia range, and I have to say, really, the advantages are really huge, especially for my patients on a daily basis. That means I can use, especially for definition, I can use less product and with better outcomes. Second advantage is I have really peace of mind in terms of late onset problems. As we saw in the past 3 years with COVID, I had some patients coming to my practice after they have injected like 9 to 12 months BDDE fillers, and they came with problems, redness, swelling, and so on. And as far as we know from our data with Nuvia fillers based on pegylation, we never ever had so far any granulomas, any late onset nodules, and this gives me really peace of mind.
But I would say this can't be the only reason why you have such a high rate of patient satisfaction by using the Nuvia fillers, or?
Yeah, that's true. I mean, as we have a really nice biointegration of this kind of fillers, it's not only a good looking result, it's also a good feeling result for the patients. They really have no lumps and bumps after I've injected them. And what you see is what you get. I don't need any overcorrection, any touch up. It's a really precise treatment with this kind of fillers.
Well, what you see is what you get. That's a good one. Now, let's talk about not only the future, but also the recent state of art. What would you say are the most cutting edge, really, technologies and techniques that exist here in the aesthetics medicine landscape?
Yeah, actually, as I'm focused on injectables, I can really tell you that there are a lot of trends. And 2 trends are really acknowledged is, first of all, less product is needed.
Good.
Patients, they don't want to be injected with 5 to 10 milliliters anymore. I need only 2-3 milliliters for full face treatment, which is a big advantage. And the second trend is, as we have seen that with biostimulation, we can create so-called hybrid products. And we, as Nuvia, we have the stimulate with hyaluronic acid for the sudden effect, and for the prolonged effect with biostimulation, we have the impact of calcium hydroxylapatate, which is a very nice product. With any trouble, we really have an advantage for our patients for the long-term results.
And that's exactly what we want and what we're looking for.
Sure.
Jochen, thank you so much for being with us here at IMCAS in the Nuvia digital world, and I look forward to having more conversations with you.
My pleasure.
And thanks to all of you for watching.